What if the reason your blood pressure won't come down has nothing to do with your heart and everything to do with your mouth? Now, you might be swallowing a pill every day for your blood pressure, when the cause for your blood pressure problem is a pain-free dental infection in your gums. A dental infection doesn't get better with blood pressure medication. It takes something else. A clinical trial put this to the test, and when they addressed the gum disease, blood pressure dropped nearly 11 points. No new medications, no change in diet. More than 80 studies now link gum disease directly to high blood pressure. Hi, I'm Dr. Chuck Reinertsen, founder of the Dental Medical Convergence. A few months ago, I told you about Melissa. She's a nurse who came off her blood pressure medication 3 weeks after we carefully removed one pain-free infected tooth. Now, it's a powerful story, but one story is not enough to change how physicians practice. So today, let me show you exactly what those studies found, why your physician has probably never mentioned it, and what you can do about it right now. Let's walk through what the European Heart Journal published in 2019, because these findings are important. They tested whether gum disease actually causes high blood pressure. The short answer is yes, it does. When patients in their trial had their gum disease professionally addressed, 3 things happened. 1, blood pressure dropped nearly 11 points. 2, arterial function improved. And 3, inflammation came down. And no new medication was involved. And they're not alone. A meta-analysis in the Cardiovascular Research publication pooled more than 80 studies and found the same connection across populations worldwide. Now, this is not a theory. It's a pattern that shows up every time researchers look for it. So how does this actually work? Now, there are over 700 species of bacteria living in your mouth right now. Most of them are healthy and we need them. Only about 20 are harmful. When you develop gum disease, those harmful bacteria enter your bloodstream and trigger chronic inflammation, the kind that raises your C-reactive protein, stiffens your arteries, and pushes up your blood pressure. Address the source and inflammation comes down. So why has nobody told you this? Because 90% of dental infections have no pain at all. High blood pressure, diabetes, glaucoma, and the early stages of cancer all progress silently for years or even decades. Dental infections follow the same pattern. The absence of pain does not mean that you're disease-free and healthy. In fact, the number one reason people don't see a dentist isn't pain or expense. It's lack of pain. Nothing hurts, so people believe they are healthy, even though harmful bacteria are entering their bloodstream 24 hours a day. But here's the catch-22. Your cardiologist rarely asks you about your gums. Your dentist asks about your blood pressure, but doesn't connect it with dental infections or gum disease. Now, it's not their fault. Most physicians were never taught the oral systemic connection in medical school, and most dentists were never taught the significance and consequences of the oral systemic connection in dental school either. So, until that changes, you have to be the one who brings it up. Ask your physician if your dental health could be affecting your blood pressure or any other part of your medical health. Ask your dentist if you have any gum disease or pain-free dental infections right now, and if they could affect your medical health. Now, you already know the answer to these questions, but please be quiet and listen to their answers. If neither one connects your dental health with your medical health, you're looking directly at the gap I'm talking about. For your complete health, you need a full dental exam from a qualified dentist, including x-rays. Then share the results with your medical doctors and let your physicians work together with your dentist to improve your overall health, even if the system doesn't make it easy. You have to be your own advocate. Your complete health is the goal. It takes a team. Now, here's what you can do right now. You can spend 8 to 10 minutes once daily, thoroughly cleaning your teeth with a soft toothbrush, interproximal brushes, water flosser, and/or floss. Now, it's good to use disclosing tablets once a week to begin with to find out any areas that you're missing. Your dentist sees you twice a year. The other 363 days are yours. That's not pressure. That's the power in your hands to make a difference in your health. One patient, like Melissa, coming off her medication, is a great story. 80 studies pointing in the same direction is an undeniable pattern. Your mouth is part of your cardiovascular health, whether your physician is asking about it or not. If you want to learn more about the oral systemic connection, check out my book, Are Your Teeth Making You Sick? It's on Amazon. Or just visit thedentalmedicalconvergence.org. If you or someone you love has seen their medical health improve after addressing a dental issue, please share your story with us at stories@thedentalmedicalconvergence.org. Now, personal stories are powerful, and you can help a lot of people. I sure appreciate it so much for sharing your story. Now, if this helped you, please like, subscribe, and share. Someone in your life is on blood pressure medication right now, and their physician is probably not asking about their gums. Become a dental missionary to your family and friends. They'll thank you for it. In the interest of your better dental and medical health, I'm Dr. Chuck Reinertsen. Thank you.